Hepatitis C. Hepatitis C, or HCV, is a virus that spreads through blood and mainly affects the liver. It messes with the body's ability to move and keep everything balanced by affecting how the liver works and how the immune system responds, and overall metabolism. HCV can cause either an acute infection, which is short-lived, or a chronic infection that lasts a long time. The effects on the body's balance can differ based on how advanced the disease is and how severe it gets. Some short-term effects on homeostasis. The first one is acute infection and immune response. Uh, Approximately 15 to 25% of people manage to eliminate the virus on their own within 6 months thanks to their immune system's efforts. During the acute phase, the immune system kicks into gear, triggering a negative feedback loop that releases cytokinesis and interferons to fight off the virus. Key terms are cytokines, antigen antibody response, and immune modulation. Another short-term effect on homeostasis is liver function impairment. Elevated liver enzymes indicate liver cell damage, disrupting metabolic balance. This can cause jaundice, fatigue, and nausea due to impairment, bilirubin clearance, and glucose management. Key concepts in this include glycogen storage and detoxification pathways. Now for some long-term effects. The first one we're going to talk about is chronic liver disease and cirrhosis. These occur when ongoing inflammation causes a cycle of fibrosis, meaning that the liver cells keep producing collagen, which only worsens the liver's damage. It's important to note that around 20% of people with chronic hepatitis C will end up developing cirrhosis over a span of 20 years. A second long-term effect on homeostasis is called metabolic disruptions. This is when glucose metabolism gets messed up, and it can cause insulin resistance, which raises the chances of developing type 2 diabetes. Additionally, changes in how the body processes fats and can result in steatoids or fatty liver, and can also increase the risk of heart problems. Uh, Homeostasis concepts and feedback mechanisms. Negative feedback. Uh, During the initial phase, the body tries to minimize harm and by activating inflammatory responses and repair processes, like regenerating the liver. However, when HCV sticks around, these processes don't work as they should, throwing homeostasis out of balance. Some positive feedback is in cases of chronic HCV, ongoing fibrosis and inflammation continue to harm in a cycle that reinforces itself, making it hard for the body's regulatory system to keep up. Now it's time for the case study, the impact of hepatitis C on homeostasis. So first we have the patient profile. Uh, medical, their medical history is Uh, their name is John Harris. Their age is 45 years old. Their gender is a male. They work as a construction worker. Uh, they live in an urban area with limited access to healthcare. And they have a history of drug use 10 years ago and occasionally use alcohol. Occasionally, uh, their family history is father has type 2 diabetes, no known liver disease are in the family. And some lifestyle factors are he moderates exercise, diet in high processed foods and low in fresh fruits and vegetables. Medical history. 6 years ago, routine blood tests revealed that John had hepatitis C. He often feels extremely tired, sometimes experiences nausea, and struggles with focus, which he refers to as brain fog. In the last year, he's noticed that his eyes have been yellowing, and he's had some mild swelling in his abdomen. 2 years back, he was diagnosed with mild liver fibrosis, which is at stage 2 out of 4. Here's a laboratory and diagnostic data table. So the ALT results in 85 UL, and which is above the preferred range, which is 7 to 56. The AST is 72, which is way higher than what the reference range should be, which is around 10 to 40. Um, the ACV RNA, which is the viral load, um, is approximately 1.5 million milliliters, and the reference range is undetectable. The platelet count is 120,000, which the reference range should be around 150 to 400,000. And the FibroScan score is 9.5 kPa, which the preferred range should be less than less than 7 kPa, which is considered normal. Um, Impact on homeostasis. Short-term effects of this are an acute infection triggered an immune system response to control viral replication, leading to elevated liver enzymes and liver cell damage. Symptoms included tiredness, nausea, and jaundice due to impaired liver detoxification and reduced bile production. Long-term effects of this would be uh, uh, chronic inflammation caused fibrosis, leading to positive feedback in liver damage. This disrupted John's ability to maintain glucose levels and protein synthesis. Uh, reduce uh, reduce platelet production and abnormal bilirubin levels disrupted his blood clotting and waste excretion, critical for maintaining homeostasis. Systematic effects include cognitive dysfunction due to elevated ammonia levels and insulin resistance, increasing the risk of diabetes. Um, Here we have a graph of liver function test results over time. So in the year 2018, we see that it's it has normal range. It may be a little bit up, a little bit lower than the average, but it's not anything to worry about that much. We can see in 2020 it increases by a lot, especially the FibroScan score, which is 8.5, and it should be under 7. Um, in 2022, we see it increases another one, which goes to 9.5, which is extremely high, what the normal should be. Conclusion. John's case uh, demonstrates the detrimental effects on hepatitis C on homeostasis. Short-term disruptions include impaired waste excretion and metabolic changes, while long-term effects involve progressive liver damage, systemic metabolic dysregulation, and increased susceptibility to other conditions like diabetes. Early intervention with antiviral therapy and lifestyle modifications could help mitigate these effects and restore homeostatic balance. Now we have the plan of action. Medical treatment. Uh, John can start antiviral medications, which begin using direct acting antivirals, or which is called DAAs, to lower the amount of virus in the body and to help protect the liver from more harm. Ongoing checkups. Schedule a blood test every 3 months to monitor liver enzyme levels, platelet counts, and the amount of virus present. Life support supplements. Take supplements suggested by a doctor, like vitamin D or milk, to help maintain liver health. What should John do for his lifestyle modifications? How should he change them? Uh, First thing you should do is to adjust his diet, which is to switch to a diet that supports his liver's health, which should include fresh fruits and vegetables, packed with anti antioxidants. He should lean proteins like fish, chicken, and beans, whole grains while cutting back on salt, and steering clear of any alcohol and processed foods. He should have a fitness plan, which he should aim for about 30 minutes of moderate exercise each day, such as walking or yoga, to boost your overall metabolic health. Uh, and then prevention measures. We should teach John how to stop the spread of HCV by not sharing personal items like razors and by keeping good hygiene practices. Also, make sure to have regular checkups for close family members to make sure they aren't infected. Long-term long-term monitoring. Schedule regular fibroscan images to assess liver fibrosis progression. Monitor for symptoms of liver cancer, cirrhosis, and take preventive steps such as vaccination for hepatitis A and B to make sure you not only have hepatitis C. Conclusion. At the end of this case, John's case shows how hepatitis C can affect liver health and well-being by disrupting detoxification, protein production, and blood clotting, while ongoing inflammation worsening these problems. By following a comprehensive treatment plan with antibiotic medications, lifestyle changes, and regular checkups, John can lower his viral levels, slow disease progression, and reduce complications. Early intervention and ongoing management are essential for improving his quality of life. Thank you for listening to my case study.